Hi, I'm Dr. Jayalakshmi Suraj, infertility consultant at Dreamfly IVF Center, Kasaragod. Today I'll be talking to you about intrauterine insemination, or popularly known as IUI. So what we do in IUI, the patients are supposed to come on day 2 of the cycle. So on that day, we'll do a transvaginal ultrasound just to ensure that the ovaries are on day 2 of the cycle. There are no active follicles and the endometrium is fully shed on date of the period. So if everything is normal, we'll be starting tablets for ovulation induction. And on day 5, we'll just do a tubal patency test just to see if the tubes are patent, if the fallopian tubes are patent, because only then the sperms can go through the tubes to reach the egg. And then we'll give them, either we'll follow up the ovulation. If they are not ovulating just with oral tablets, we might give injections also to them. And then we'll do the follicular tracking. That means the patient will have to come every 3 days to see whether the follicle means the cyst in which the egg is growing. So when the follicle reaches the adequate size, we'll give a trigger injection. That is just to time the IUI. Once the trigger injection is given, we'll be doing the IUI 35 hours after the trigger injection. So on that day, the husband will have to come and give the semen, and from that we'll process the motile sperms, and then we'll be transferring it back into the uterine cavity. So this is actually done and there will be no anesthesia, but it's not a painful procedure at all. And after IUI, the patient can have a normal life. They can go for work, they can have all the normal routine activities, they can have intercourse also. Everyone can ask, what is the chance of success in IUI? The success in IUI is usually only 10 to 15%. That means if you do for 10 couple, 1 or 2 will become pregnant. This is because in normal intercourse, the chance of conception is about 8%. That means if 10 couples have intercourse, those who does not have any problem, if they have intercourse, only less than 1% will conceive. So in IUI, the chance of conception is marginally increased by 10 to 15%. So that is the success rate that any couple has to expect when they are undergoing IUI. Then another indication for IUI is donor insemination. Suppose there is a couple who does not have sperms in their semen, that is known as azoospermia. In such cases, what we do is actually micro TCA plus ICSI. We will extract the sperms from the testes and then we'll do an ICSI for them. That is actually an expensive procedure. So if the couples are not able to afford such an expensive procedure, we can undergo this donor sperm insemination for these couples around the time of ovulation. Even that has a chance of conception is about 10 to 20%. So these are the indications for IUI and the success rate of IUI. And complications, actually there is not much complication for IUI. Only thing is because of the ovulation induction. There can be hyperstimulation and patient can have some nausea, vomiting or distension of abdomen. But usually in such cases, we do not overstimulate the ovaries for such females. When the couple is undergoing IUI treatment, we don't overstimulate the ovaries. So such complications are very rare in IUI. Only thing about IUI is the chance of conception is only 10 to 15%. Only that you have to keep in mind. The chance is low. It's unlike in IVF, but the chance of conception is about 50 to 60%. So suppose your IUI is failing, you can do IUI 2 or 3 or even 4 times at an interval of 1 month each. And suppose you are failing 3 or 4 times. Usually what we do is, if you are failing, if you are a very young couple, your ovarian reserve is adequate and your male factor is okay, then what we advise laparoscopy just to see if you have any other causes, especially any pelvic inflammatory disease or endometriosis which are hampering your fertility. So suppose you are having any other cause, you will have to go directly for IVF. So if your IUI is failing 3 or 4 times, if your laparoscopy is abnormal, you will have to go for IVF. Otherwise, if the laparoscopy is normal, again we can wait for 3 or 4 months and you can do IUI in between. And even if that is failing, that means you are definitely a candidate for IVF, because your oocyte or your sperm or the quality of the embryo may be the reason for your infertility. So in such cases, IVF is definitely indicated. So what you have to keep in mind is, whenever you do IUI, just limit it to 4 or 5 times. If it's not working in 4 or 5 times, and usually it works in the first or second cycle. If it's not working, it's better that you go for IVF.